Hello, hello, hello. Yes, I am back on live. I know y'all saying, wait a minute, Rob and Michelle. It is not 7:30 p.m. at night. What are you doing on live? Hello, hello, hello. Welcome, welcome, welcome. Welcome to We Care Coaching and Consulting. This is Coach Robin Michelle, and we are on live. I normally am on 7:30 p.m., but I had to cut people short this evening, so I decided to come back on. I am helping people start their own home healthcare agency. So if you own a home healthcare agency or you want to start a home healthcare agency, I want you to drop me a number one. Drop me a number one. Hey, Beverly. Hey, Michelle. Hey, Mama. Hey, Monica. What's going on, people? Come on in, come on in, come on in. That's right. I decided to come back on. We are talking about how to start you a home healthcare agency, how to start being able to make 6 digits. Who's looking to make 6 digits? Who's looking to make 6 digits in their home healthcare agency? Drop me a 1. And what I want everybody to do is I want everybody to tap the screen. Tap the screen and show me some love. Tap the screen and show me some love. Okay, I'm about to start going over with you guys where you guys can go start finding some clients. Now, I've been realizing something. I've been giving a whole lot of information away. But I don't know if people have been taking advantage of the information. Okay, so I decided I'm going to open it up to another market and start coming on twice a day. Okay. Who in here? Okay, I got a couple number ones. So that means you guys own a home healthcare agency. Monica, Michelle, you guys own a home healthcare agency. Somebody said they haven't started yet. Who is that? Monica. Okay, well, Monica, how far are you into starting a home agency? Have you started getting your license yet? Where are you at? Or are you just thinking about starting to get your license to be a home healthcare agent? Okay. Hi, everyone. I am telling you about how to start a home healthcare agency and where to go find clients. Are you interested in finding clients for your agency? Okay, so guys, I need you to get a pen and paper. When you got a pen and paper, let me know you got a pen and paper because I'm going to give you a website that's going to give you access to where you can get a whole bunch of clients real fast. Okay, Monica, you thinking about it. Well, I'm going to tell you this, and I hope this is going to motivate you. My first 7 months, I made $1.1 million in signed contracts. 7 months in business. I've been in business now for 2 years, and I absolutely love it. I started it because of my own health journey. I have to have 6 surgeries. I've been in and out of doctor's office and hospitals since 1997. So I decided to do this for other people. And now I'm teaching people how to start their own agency and how to be able to make the money. When you guys got a pen, let me know you got a pen so I can give you this website. This website is going to tell you where all the places 62 years and older are in your community. Let me know when you got a pen. Put a number 1. Put a number 1. I don't know what's going on that I think it's some medicines that I'm taking be making me itch all the time. Okay, so Dollar Goddess, what's up, Dollar Goddess? How you doing, sweetie? I think you DM me. Okay, so Dollar Goddess got a pen. Anybody else got a pen? Come on, get a pen, get a pen, get a pen. I'm about to give you a really good website. Thank you for joining. Thank you, every woman. Thank you for joining. Thank you for joining. You guys send this invite out and give me some hearts. Give me some hearts. Give me some hearts. Tap your screen. Tap your screen. Me too, since 2023. I'm disabled RN in Texas. But let me tell you something. Do not let that stop you. I need a shoulder replacement. I need a hip replacement. Both of my knees and both of my feet are doing bad. As you see right now, I'm laying in my bed. If you notice on some of my videos, you see this background, that means I'm in the bed. I have fibromyalgia, rheumatoid arthritis, and spinal stenosis. Okay, so don't let it stop you. But if you are looking to start an agency, one website you can go to is called seniorhousingnet.com. seniorhousingnet.com. You go in there, you put your zip code in there, and it's going to pull up all the communities in your area for 62 years and older. It's going to give you the phone number to all the places. You start calling the places. You ask to speak to the office manager, or the activities coordinator. You let them know that you are a home health care agency in the community and you would like to come out there and do some type of activity. You can do some type of bingo with them. You can do some type of word trivia with them. It's a lot of different activities you can do. You can tell them, I'm going to bring refreshments out there, and guess what? You talk to the people. Hey, sweet. Yeah, Graceful. You know why, guys? If you knew, Graceful knows who I am. I cut you guys short this evening and I couldn't sleep, so I decided to come on in and talk to you guys some more. It's all about knowing exactly where you want to go with your business. Thank you, Miss Terrence, for the stickers. I appreciate it. Knowing where you want to go in your business. Can you please help me with a HCH homemaker application? I'm really having a hard time. Absolutely. You could go up to my bio and you could grab a link and book a strategy call with me. The strategy call is for an hour and I will help you go through it. Not a problem. Not a problem at all, Mar. I have a couple slots open for next week. Absolutely, I will help you. Absolutely. Those applications can be very difficult and can be very stressful, but I will definitely help you out. Go up there and grab that link. But guys, you have to change your mindset. If you have been working for your whole life, you have a mindset of 9 to 5. What's ahead? Just curious. You can stay tuned and you can find out what we're going to be talking about. But we're going to be talking about how to grow your agency. You have to change your mindset. You have to change how you think, and you have to be willing to put the time in to learn how to market, how to network with people, okay? If you're going to be in the home health care agency, you have to understand this is a relationships game. Should I start with a business plan or an LLC? That's a really good question, but give me 1 second, Monica, I'm going to get back to you. You have to realize this is a relationship game. You have to make relationships with people. The first thing you want to start doing if you own an agency or before you get your license is you want to come up with a text that you can send out to everyone in your phone and let them know that you're about to start an agency and what services that you have to offer. Start with your warm network. Start with your neighbors. Let them know that you have an agency. If you have an agency and you had it for a couple years, you are doing a relaunching of your agency. Okay. My phone keeps misspelling. Are you trying to say HHA? What are you trying to say? AHCA? Where are you, Miss Terrence? Okay, but Monica, to answer your question, you said, should I start with a business plan or an LLC? I'm going to tell you, you should start with both. Number one, the first thing you need to do is get you a black and white composition book and start writing your business plan up and make you a rough draft. Okay. You need to get your EIN first. You can go to irs.gov/EIN. To get your EIN number is free. Oh, you was curious what the application was. Who is it that asked that question? Let me go back. Who is it that asked if you could get help? Mar, are you still on here? MAR, are you still on here? What was I going to say? You want to get your EIN number first. Okay, your EIN number is free. Your EIN number is a 9-digit code, just like your social security number. Then you want to start working on your business plan. Okay, once you start working on your business plan and you get your EIN, I'm in Pittsburgh. We spoke a couple times. Oh, okay, Miss Terrence, very nice. Through DM. I try to keep up with as many people as possible when I'm talking on DM to give you guys as much information as I possibly can. Then you want to get your LLC. You can go to LegalZoom. You can go to LegalZoom to apply for your LLC. Okay. Now, once again, let me talk to the people that have their own their agency. If you own your agency and you're trying to get clients, guys, I'm trying to get some light in here. Trying to get clients, you want to start networking. Okay. You want to start meeting people in your community. Okay. You want to start meeting community leaders. Okay, you also want to start going out to different facilities. There was 30 places I gave out the other day of different facilities that you need to go to and start making relationships. Okay, number one, the VA is really big. There's a lot of veterans that needs help getting services. You also need to look up this on seniorhousing.net. Okay, you put seniorhousingnet.com. Seniorhousingnet.com. Put your zip code in. It's going to show you all the places in your area. Okay, you want to look for the luxury apartments. You want to get yourself some postcards made up. And you want to go in and you want to start. You want to leave some postcards, and if you can get into the building, you want to start putting postcards under the door. That's your private money. That's your private paying clients. Okay. You want to go to different places. You want to go to chiropractors' offices. Chiropractors adjusts the back. Okay. A lot of seniors have problems with their back. You want to go to orthopedic surgeons. Orthopedic surgeons are the people that's going to do a shoulder replacement, a hip replacement. Okay, they're dealing with seniors all day long. I was 40 years old when I first needed a hip replacement. I just turned 56 and they're going to do it. Okay, so they are working with people over 55 years and older. When you have a replacement, you're going to need an aide to help you, especially when you get out the hospital. You can get some clients there. You want to go to your senior daycares. Guys, let's keep tapping the hearts. Let's keep tapping the hearts. It's 11:33 at night, and I'm on here trying to give you guys some gems. Okay, you want to go to your senior daycares. You want to speak with the coordinators there. Thank you for liking the live, Monica. Hey, Kizzy Love, how are you? Thanks for joining. Thank you for liking my live. Thank you very much. Hi, Glowbug. What was it called again? Senior Housing Net.com. Seniorhousingnet.com. Okay. You want to go in there. If you got your laptop or you got your phone, go ahead on there right now. I want somebody to go on there and put their zip code in there and come back and tell me how many communities are in there. Okay. You guys want to reach out to these communities. You want to go to Vistaprint. You want to go to Vistaprint and start getting you some postcards. I tell you to get, how you doing, Sunshine from Florida? So Florida, warm states. Texas, warm states. You warm states, guys. You guys got all the snow bunnies. You guys are sitting on the money. There's clients out there. There's over 66 million people on Social Security. Okay, there's plenty of clients out here. We just have to find the clients. We have to find the clients. You guys, you can go to Vistaprint and you can create you a design. You can go to Canva and create you a postcard. I tell you a postcard because you can get 4 postcards out of an 8x10 like you would a flyer. Okay, and you want to start handing it out. You want to go to your county assistance office or welfare office, start handing out flyers. You want to go to your social security offices, talk to people, tell them what your services is. I'm doing great, thank you. How are you? I'm doing good, can't sleep. That's why I decided to come back on, because I'm only did an hour today. So I said, let me come back on and see who out and who's up late that I can talk to and give some gems to. Guys, you want to hit the free health clinics. The first of the month, you want to go to the supermarkets. All the seniors are at the supermarket. But you got to remember something. Owning a home health care agency is for people 21 years and older. Okay? You can go to dialysis centers. You can go to support groups like Parkinson's support group, caregiver support groups. The people are out there for you guys to meet. While I'm driving, can you talk about sam.gov? I sure can, Graceful. Sam.gov is where you go to get your cage code. You need to have your cage code so you can work with VA clients. Okay, you want to be able to get into the VA communities and talk to the VA social workers and let them know I have my cage code. I'm part of it. But you can, you got companies like TriWest and Optima. All they do is process the referral. So you want to go to your veteran centers. You want to go to the veterans hospitals. You want to hand out these cards so you can talk to people and you can start building relationships. Okay. I have a ebook that I put together, the 18 proven places that you can go to get clients. These places is where how I was able to start I made $1.1 million my first 7 months in business. Okay, can we register on SamGov? Yes, you can register on SamGov to get your cage code. And Graceful, we'll go over that tomorrow. I'll do a share screen with you so you can actually see how to apply. Graceful Care from Florida, she is actually doing her strategy call with me for an hour tomorrow. We're going to be sitting on the phone. We're going to be talking about where she is in business. I already have some idea because we've been talking through DM and how to help her get more clients. Guys, you want to visit places like adult daycares. You want to go there. You want to put on some type of activity. You want to bring refreshments. You want to do a question and answer. The seniors, when I went to places, they told me that I was the first agency that ever came to let them ask questions. You have to listen to people. I have my cage code under consulting. Can I use it for home care? That's a good question. I'm going to look that up. I'll look that up for you. Send me a DM. Oh, thank you very much for sending me that, Rose. I appreciate it. And guys, if you guys are on there, it is going on 12 o'clock midnight. If you can go in that pink box with the heart on it and get me one of those popular lies for 1 cent is 1 cent, I would truly appreciate it. That lets Live know that I'm giving out some information. I just started working with TikTok. That's why I'm giving the discounts I'm giving with my consulting calls, because that was the agreement that I made with them. So I'm here to help you answer any questions. We have 19 people on here. Guys, any questions that you have, drop the questions in, because I'll be glad to answer any questions that you have. Okay, if you guys are in need of manuals, policies, payroll forms, if you need virtual assistants, if you need places to do payroll, let me know. I'll give you guys this information. People charge, for my coaching platform. My coaching platform ranges anywhere from $2,500 to $10,000. The information I'm giving you guys, people, pay a lot of money for this information. So really take advantage of this information that I'm sharing with you, because these are going to be strategies to help you build your agency, help you get your agency to 7 figures. It is very easy to get to 7 figures. You need a handful of clients, to be able to hit $1 million. Okay, if you have private clients, you can be charging anywhere from $30 to $40 an hour for a private client. All you need is one private client. All you need is one person to give you a testimony. Then you can do their whole community and says, I service some of your neighbors. Okay? That's very important. People, tell me what state are you in? How you doing, Miss Chen? Tell me what state you in. Tell me how many clients do you have? And guys, keep tapping the screen. Keep tapping the screen. Let's get these hearts going. Let's get these hearts going. See if we can get up to $5,000. I'm going to stay on here till about midnight with you guys. Just talking with you. PA trying to go to Florida. Florida. Oh, okay. Yes, Florida. Florida, you got to be really ready. All the baby boomers are in Florida. Okay, and when I say baby boomers, those are the older people. They are building communities left and right in Florida. I understand that Florida is strict, okay, but that's why you have to make relationships, okay? Even if you're out there early in the morning waiting for some of the employees come in, like, listen, I know you speak with a lot of agencies, but, I just want to leave you my card. If I can just leave you a couple cards that you can leave out there, you just got to meet the right person, and you can't give up. You can't get up. Even if, it's not a gated community, even if you see someone and it's a gated community and it's a crossing guard, you could say to him, hey, can I pay you to pass out a flyer out to everyone that comes in the gate? Would you pass one out for me? You offer him enough money, he'll do it. I'm familiar with Florida. The application is strict. I have potentials. Okay. Well, you got to make sure you do that application, and you have to make sure that you're doing it under a microscope and you're answering everything correctly, because you don't want to answer a question and then something's wrong and you have to go back. Okay, Dollar God is you're on Merlin. I'm in Merlin too. Thank you very much for Miss CEO for the heart me. I appreciate it. Anytime you guys want to sit down and talk about strategy, you could go up to my bio and get the link. I have a couple slots available for this coming week, and we can go over whatever issues that you are having in your agency now. I've been working with business owners since 2002. I don't just help you with, the home health. I help you with the home health care part, but I also help you with getting grants, with getting funding, with getting business credit for your home healthcare agency, because you're going to need that business credit, because your MCOs can be 30, 45 days while you're waiting for money to come in, and you're still going to have to pay your staff, so I will go over all of that with you during your strategy call. So that's something for you guys to think of. Another place for you to want to look up is American Legion. American Legion is where the vets, it's like their fraternity homes. It's where they go and they go play checkers, and they have events there. You need to call and find out who the coordinator is, who is the district administrator. Find out if you can come in and you can hold an event. They have the email to all the vets. Okay, imagine if you get a room of 50 vets in the room. Okay, and you're giving your presentation to, you're going to walk away from a couple clients. Okay, you got to think outside the box. If you're not comfortable with calling the hospitals, calling the nursing homes, I will get on the phone with you. I will shadow you. I will do the presentation for you so you can hear what I'm saying to them until you get comfortable. I will role play with you. I just need to know what the issues are that you are currently having. Guys, let's keep tapping the screen, tapping the screen. Let's keep these hearts going. Let's keep these hearts going and let's invite some people out. Build wealth digitally. Thank you for coming in. Build wealth digitally. Are you a digital marketer? We might need to talk. Build wealth digitally. We may need to talk. We may need to talk because I'm into digital marketing myself. I believe in multiple streams of income. But you guys need to see if you could find a local paper. See that, every community has a free newspaper that goes to everybody's doors. You need to call them and find out how much it'll be for you to market into that newspaper. Like in Philadelphia, it's the Metro newspaper. And I think it's $2,700, but it goes to over 20 million people. I think it is. Of course, I'm going to pay that money. It's a tax write-off for me anyway. So why do I care whether I'm going to pay for it? I'd rather pay for that than pay taxes. Guys, let's keep tapping the screens, tapping the screens. Let's tap the screens, tap the screens. Let's get these numbers up here. So guys, talk to me. Building wealth. Tell me what you do. What state are you in? Do you have an agency at this time? Hey, how are you? I'm interested in starting in, is that supposed to be Atlanta? I need information, please. I live in Florida. Okay, you said I'm interested in starting in a what? What is that word? ALF? ALF? Oh, assisted living facility. Oh, you want to start an assisted living facility. I was going to do one of those down in Columbia, South Carolina. Oh, I would love to work with you on an assisted living facility. Okay, are you trying to open one or you're trying to market to one? Netta, are you trying to open an assisted living facility? Or are you trying to market to one? PA got approved from home care and all the MCOs are closed at this time. What's next besides private pay? PA approved home care agency. All the MCOs are closed at this time. What's next besides you got your VA clients? You got your private pay. You could go to the Philadelphia Agent of Corporation. What part of Pennsylvania are you in? Hello, I have a home healthcare agency stuck with one client from Maryland. I need more clients. What part of Maryland are you in? Thank you for giving me that love, that fan club. Thank you, thank you, thank you. What part of Maryland are you in? Okay, and we got someone else in Pittsburgh. You're in Pittsburgh. Okay, you got private pay. You need to start making relationships. You're going to have to really focus on your private pay. That's what you're going to have to do. You're in Baltimore, Maryland. Okay, so you're in the city part. Okay. I really want to talk to you. Miss CEO in Pittsburgh that's having a problem with the MCOs. We really got to strategize how you can get some clients and get your agency growing. You're going to have to be willing to be on the streets and making relationships and talking to people. Are you willing to put the time in? Thank you very much for the donut. Thank you for the donut. If you're willing to put the time in, put a number 1 in there. Thank you. Oh, I absolutely love it. You are showing me some love. Thank you. Now, if you're willing to do it, I will work with you to help you do it, but I have to know that you're dedicated and you're willing to do it. Thank you for the winks. Thank you for the winks. Thank you for the roses. Thank you, thank you, thank you. So if you're willing to do it, we can set something up. Go up there in my bio and go ahead and book that call so we can set it up and we can get you moving. Build wealth digitally. I want to know what you're doing. That's what I want to know, what Build Wealth is doing. Build wealth digitally. Are you a digital marketer? Also, build wealth digitally. Thank you, Monica, for the rose. Thank you, thank you, thank you. Because if so, I would love to talk to you about some digital marketing. Yes, I would love to connect with you. Yes, yes, absolutely, Miss CEO. Um, Build wealth digitally. Home care in Texas. Okay. I was just curious by your name. So you are 100% build wealth. Okay. So build wealth digitally. Make sure you look up seniorhousingnet.com. Seniorhousingnet.com. Put your zip code in. It's going to pull up all the communities for 62 years and older in your community and all around the surrounding communities, and it's going to give you the phone numbers to these places. Call and ask to speak to the activities coordinator and ask them if you can schedule something for the end of this month. Okay, we're going to get you guys in a couple places this month, so you guys can be talking to some people. Okay. But in order to do that, you guys got to sign up and, set your strategy call up for me so we can get this done and I could be working hand in hand with you. Beloved's Home Care, you're in Florida. Thank you, Miss CEO. Thank you. Yes, we'll work together. We'll work together to get you some clients. Because guess what? Your business is now going to become my business because I want to see you succeed. Because you know why? I'm going to ask you for a testimony. And I want you to be so excited to give the testimony to tell people, oh, Robin Michele helped me get 3-5 clients within my first 30 days. We're trying to get some clients within 60 days. You're going to have some clients. That's what we have to do. I have over 50 places you can go and get clients from that people don't even think about going. And this is why I never had to use any type of paid advertisements, because I did the research on how to get the free advertisement, and the free advertisement works. We will role play. We got to look at your paperwork. We got to do an audit. We got to see how things are going. How you doing, African Fashion? How are you? Thank you for liking the live. Blove's House. Thank you. You guys keep tapping the screen. I appreciate it. And where else? You guys need to go to the Lions Club. You need to look up the Lions Club. The Lions Club has been around since 1903. They are where all of the political leaders are. They are where all the community leaders are. They have 4,600 clubs around the world. Okay? You need to Google them. You need to find out when they're meeting up, and you need to go in there. You need to be in front of these political leaders, letting them know I have a home health care agency. I can help the people in the community. You want them to push your information. And guess what I'm going to do? I'm going to do it myself on Monday. And I'm going to tell y'all exactly what happened. And if it's a way that I can record it, I'm going to record it so you guys can hear it. Because guess what? I'm not intimidated to call and speak and talk to nobody. I could talk to a doctor. I could talk to a surgeon. I could talk to Donald Trump. I met Donald Trump in 2012. I'm not intimidated to talk to people. We just got to get you guys past intimidated. You need to be calling your councilman. You need to be going down to your mayor's office, talking to your mayor, letting your mayor know what you're doing with your community. Ask her if she can come to your office and you guys have a big barbecue out there, and ask the mayor, will she come out and speak to the people in the community? Can you imagine if you got the mayor out there in front of your agency and she's talking to the community? Give me the phone number. I'll call the mayor. I'll get it set up. Oh, thank you. Thank you. I will get it set up. You in, what is that? San Francisco, Florida? San Risco, Florida? Okay. I will come to Florida. It is nothing for me to jump on a plane. If it's whatever I have to do to help my client, I'm there. And especially if we're going to put on a big event. Imagine if you put a big event on for your facility, for your agency, how many more clients will come out? Okay. All you got to do is go get a couple cases of chicken, have somebody make up some rice and cut up some fruit and do some chicken and some rice and make some free meals out to pass out to people in the community. Have the mayor out there speaking on the phone, or have your congressman out there talking on the phone, and they just keep saying the name of your agency. Your agency is going to grow. Okay, network with physical therapy places. Ask them if they want to put an event on together. Okay, go to the rehabs. Tell them you want to put an event on together with them. Guys, the only thing that people can say is no, but they will say yes. If they have someone else that's going to help them cover the expense, of course they're going to do it. Okay, and I'm telling you guys, if you do this, you're easily going to walk away with 5 to 10 clients your first month. I'm telling you how to do it. I want to know who's going to do it. Join Teeth African American Club here in Florida. I'm praying I get a tent. Okay, very good. Loves Home. Okay, June 10th, the Afro American Club here in Florida. I'm praying I get a table. I pray you get a table too, baby. DM me, because I'm going to tell you everything you need to have on your table. Okay, everything you need to have on your table. Do you have clients already? Beloved's Home Care. Do you have clients already? I know you're going to get a tent. Oh, no, you don't have no clients? Okay. Do you care for your mom? Do you help your mom out? Beloved's Home. Do you help your mom out? Oh, my mom just passed too. Okay. Anybody in your family that you help out? You can, if you help take care of your mom, you can have a picture of your mom on the table and tell them, this is my mom. I took care of my mom. My mom passed away. If you have an uncle you're taking care of, you just need testimonies. But I'm all in ALF. Okay, it's fine. It's fine. Guys, you got to be willing to do the marketing. You got to be willing to go in front of people. You got to be willing to talk to people. You can't be willing to give up. I have in the Grow Your Agency Blue Book that I got, I have scripts in there that you can read, you can practice, you can go over. All the information is in there. What questions does anyone have? What questions? I'm here. Ask me questions. Ask me questions while I'm here. It's 15 of us in the room. Thank you for that, Rose. Thank you very much, guys. And thank you for tapping the screen, And if I can get some popular lives, I would really be happy. They in that pink box. Them popular lives. They say a lot to TikTok. Hi, Elizabeth. How are you? Oh, that's what I needed. Thank you, beloveds. Popular love. Yes, 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 yes. Yes, my sister. Yes. That tells TikTok that thank you very much, Ziva, for the love me. Thank you, thank you, thank you. Um um okay, so Miss Glow. Um I don't want to mispronounce your name. Where are you from? What certificate? What certificate do you need to open your home care? Where are you located? What state? How long have you been in business? I've been in business. Well, I've been in business since October of 1992. I've been an entrepreneur. I've opened this particular business October of 2023. I have three businesses that I own, but this one since October of 2023. Okay, Pruvens lives in Maryland. So Maryland, you're trying to do your paperwork in Maryland. I've been in the home care since January 2025. Okay, do you have any clients? You let her? Proven you, so proven you have clients? Yes, I have 12. Okay, I have 12. Someone says they have 12 clients. Very good. Very good. Very good. So we're trying to double that number. We're trying to double that number by the end of the year. That's what the goal is. You need to make sure you go in there and you book your call with me um, before this live is over for next week. I think I got 3 or 4 slots still available so we can make your plan. Another place you guys can go to is called the Rotary Club. The Rotary Club is another club that has been around for a very long period of time where you can work with community leaders and you can go and can start rubbing shoulders with them. It's going to be a lot of community leaders that are in there and you can let them know the service you have to do. I would tell everyone when you're going to the Lions Club or the Rotary Club, you need to say that you specialize in something. Like I specialize in dementia. I specialize in people that are bedbound. You need to have a couple specialties. You need to tell them you're open 24 hours, 7 days a week. You need to sell it. No, it's Rotary. Yeah, you got it. Rotary. Yes, that's correct. Look that up. Look that up. It should be right in your neighborhood. Those are where influential political and community leaders go. That's where you need to go to start rubbing shoulders. You need people to open the doors. Yes, the chambers of commerce. Absolutely. And you need to join the chambers of commerce and pay that fee to get in there. How would I want to know what certificate I need to start in Maryland. Okay, if you want to start up in Maryland, I can help. I can help you with that. Go ahead and book an appointment with me. I don't have my computer open right this moment because I'm in the bed, so I don't have all that information with me. But I can tell you what you have to do step by step to get started in Maryland. Absolutely. Typically, I come on at 7:30 in the evening, and that's when I'm sitting at my desk, and I would have been able to look it up for you, but I am not at my office right now. Dementia. Okay, dementia. All right, very good. Okay, guys, you also want to, when you're calling the hospital, if you're calling the hospitals and you're being connected to the social worker departments and you're not getting through to the social workers, you want to call the administrator of the hospital and tell them you're a home health care agency in the neighborhood and you've been trying to get in contact with the social worker department, but nobody gives you a call back, and you're trying to come in and set up a luncheon at the hospital. And let me tell you something. Anybody in Baltimore, Baltimore is also a booming state. I'm thinking about opening in Baltimore also. So, who was that in Baltimore? Beloves. That's why I definitely no. That was proven. Proven. I definitely want to talk to you because I'm actually thinking about opening in Baltimore too. Maybe it's something we can partner on. Proven. Hello.
Yes,
Yes.
yes.
What are you saying, love?
I'm on. You say you wanna open in in Baltimore. I live in Baltimore.
What part?
Maryland.
What part?
I'm let's say it's Glen Burnie with Baltimore is so like 10 minutes or 7 minutes.
You're 10 minutes to 7 minutes from Baltimore City.
Yes.
Okay, I'm in Windsor Mills. Do you know what Windsor Mills is?
Yes.
I'm in that area.
Oh, okay. Okay, I see.
Yeah, yeah, I'm in that
Yeah.
area. I'm in that area, but it doesn't matter what area it is. So we can definitely talk. Do
Yes.
you have your license or you're getting your license?
I'm getting my license. That's why I'm keep asking you which one I need, I need your advice
Okay. All right.
because yeah.
Well, make sure you before you end tonight, you go ahead and you book a strategy call. It's right there in my bio.
Okay.
And go ahead and book an appointment and we could talk. But I really, really want to talk to you because I really want to talk to you about maybe us doing some partnering up together. Me helping with the marketing aspect, you working with the aides, the clients, and I do the back end work because I definitely want to open up in Baltimore. In Baltimore, are you there? Did I lose you, Provident? I think I lost her. But if it's anyone else that's in Baltimore, I'm looking to partner with someone in Baltimore, for an agency. um because I have one in Philadelphia, but I'm between Baltimore and Philadelphia. So in Baltimore, it's a lot of need in Baltimore
Exactly.
for care in Baltimore. So that's why I definitely would love to be part of it. So we can talk about that. Any questions? Let me look at. Did I lose you? See, uh, you know what? Let me get up. I'm gonna
I'm
just
still here. Yeah, I'm here.
let me get up and look on my computer. Hold on. Oh, ouch. Okay, hold on. Let me look. Oh, okay. I'm gonna look this up. And do you have a office yet,
Not yet.
Provident?
Not yet. I'm still at home, but
Provident.
yes, are you? Can you hear me?
Hello.
Hello?
Okay. Anybody else has any more questions? How would I get my certification? Hold on. Let me open my computer. I can tell you right now. You know what? This never completed. Um, Hold on one second. And right, let me see. Let's see what it says. Guys, any other questions while I'm looking this up? Let me see. Any other questions while I'm looking this up? Hi, beloveds. How are you? Tell me what's going on with you. You know what? I'm going to have to go someplace else. How do I get my license as a home health care agency in Baltimore? I'm marketing for private clients. How are you marketing for them? Okay, so you got to complete the Merlin home care agency application and pass the required inspections and reviews. Obtain your state license before providing services. So it's basically like everyone else. Do you have the application? Provident, are you still here? I don't know if she's still here or not. She might have left. She might contact me later. Okay, so how are you marketing for private clients? Rehabs, through doctor's office, RNs, nursing homes, and hospitals. Okay, are you email campaigning them, or are you just calling them on the phone, or you going in person? Which one are you doing? Thank you for tapping the screen. Who's showing the love? Thank you, thank you, thank you. Going in. Okay, make sure you get email numbers because you want to start an email campaign with them. You could do an email campaign through MailChimp. Okay, you could sign up for MailChimp for free and it'll allow you 250 contacts, and you can use ChatGPT to do your email campaigns. Put them in a system for 30 days and it'll run themselves, and the emails will automatically start going out to them every like 3 days and keep them nice and warm. So that's something else, beloved, we could talk about, on our one-on-one strategy call. If you book a call with us, we can go over how to go about marketing. Thank you, beloved, for the hand heart. Thank you very much. Thank you very much. We could talk about that. We could talk about how to get private clients. We could talk about how to get into some of the facilities. We can make calls on your behalf representing your agency to get you some appointments at some different facilities. That's not a problem. Also, we want to make sure that you guys are trained on knowing what to say when you call the different facilities. My book, Grow Your Business Blueprint, has scripts in there to actually tell you what to say and how to say it. So you don't be stumbling and fumbling all over yourself because you want to sound professional at all times. Guys, your paperwork. Let's talk about your paperwork. Okay, your paperwork must be prestige. Okay, you must have your paperwork in order, especially the paperwork you take out to your clients. You got to have your policies, your procedures, your manual. You got to make sure everything is in compliance. You got to make sure that all the paperwork that you're getting your clients to sign, that you have everything. You got to make sure you're getting a copy of their insurance card. You got to make sure you're getting a copy of their license. You got to make sure they're filling out that form, that especially that form with all of their medical issues. You got to make sure when you go there that you're getting all of their medications. You got to tell them, I need you to have all your medication out so you can write those forms down. You can write that information down. Because if not, if you go through an audit, you're going to get dinged. You're going to get dinged. Okay. Do you take insurance? I'm having a time in Alabama with them approving. What do you mean, do I take insurance? I don't understand what you're saying. Do I take insurance? Do I take insurance for what? Oh yeah, I take insurances. I take Keystone, I take UMPC, I take PA Health and Wellness, and I take private. I take Aetna also. And we have our cage codes, and we are working with VA clients and private clients. Absolutely. Absolutely. And I know it can be a struggle for you when you're first starting out and having to be patient. Well, beloved, go ahead up there, make that appointment, baby girl. You got me. You got me. And make sure everyone is in compliance. You got to make sure your caregivers are in compliance. With your caregivers, I have all my caregivers must wear scrubs. They must wear scrubs when they report the work. Okay. If I do a spot check and one of my aides does not have on their scrub, I send them home and they have to come back with their scrubs on. And I stay there with the client. Why do I stay there with the client? That gives me the opportunity to talk to the client, find out which one of the client's girlfriends need my service. You need to be asking all of your clients, do you know anybody that needs services? Because if you know anyone that needs services, I pay a marketing fee of $500 if you have anyone that needs services, but I pay you 30 days after the client starts. So when that money, their insurance money comes in, that first payment, you pay them with that. You don't pay them out your pocket up front. You wait until you get that first payment. 1099, right? Yeah, anyone is doing marketing for you, recruiting for you, you have them sign an independent contract. So you can pay them that way, and that's a tax write-off for you also. Okay? Guys, if we could grab some of them popular lies, they're only 1 penny, 1 penny. Can we get some popular lives going on? We sitting here talking at 11:17 midnight. Grab me some popular lies and let TikTok know that we are still alive and we are doing well. And guys, if everyone is 19 people on the screen, if everybody, thank you for the popular love. Thank you, thank you, thank you. I really need that. That lets TikTok know that you guys find that as a value. Thank you, Miss CEO. Thank you, Miss COO, that you guys value this this live. And I think I'm going to start doing 2 lives a day. I haven't decided yet because I've been doing 1 live. So this is the weekend. Let me ask you guys a question. Do you think I do one at 7:30 Eastern Standard Time? What time should the other one be? Y'all give me some suggestions. What time would you guys like me to see me do another live? Should I do it before 7:30 or should I do one from like 7:30 to 8? 7:30 to 8:30 and then start another one up at 9 o'clock and do from 9 p.m. to 10 p.m. Or should I do one from 3 p.m. to 4 p.m.? I need you guys' help. Which one? You said yes, the 3 p.m. to 4 p.m.? I'm trying to decide what time I'm going to do another live. The 3 p.m. to 4. Okay, so 3 to 4 or 9 p.m. Okay. I might even do the 9 p.m. I might do the 7:30 to 8:30 and then do a 9 to 10 and see how that goes. Maybe on the weekends. I don't know. I'm going to 9 p.m. It's 9 p.m. you think? Yeah, because people on the East Coast, it'll be easier for them. But what we're going to be doing is we're going to be talking about grants. Everyone on here, I want you to go watch a video that I did today. Verizon Wireless is putting out a $10,000 grant. You still have time to do it. Okay, all you have to do is you have to watch 2 videos. The videos are 28 minutes apart, and you have to fill out the application, and it puts you in line for the $10,000. I think they're giving it away to 10 people. Okay. Tomorrow when I come on at 7:30 p.m., I'm going to be giving you guys about 6 different places where you can go and you can apply for grants to help you in your business. And some of you guys might want to think about getting some SBA loans, because some SBA loans, you could get them at a really small interest rate, especially the ones, guys, let's keep these hearts going. Let's keep these cards going. Yeah, go ahead and book your appointment. Hold on. I got to do this before they cut me off. Okay. I'm going to be doing the grants for you guys. I'm going to have about at least 6 of them tomorrow. I'm going to tell you the website. I'm going to tell you the credentials, and I'm going to tell you what you have to go through. Let me tell you guys, there are over 200 grants out here. I'm going to start doing 5 grants a month for myself. That's what I'm going to start doing, and applying for grants. For myself. So all the ones I'm going to be doing for myself, I'm going to be sharing with you guys. Because if you put 5 grants in, sooner or later, somebody's going to give you some money. And to take 5, if you do 5 grants a month and they all take 15 minutes. So if you're taking an hour and 15 minutes, to do your grant applications, you're good to go. Most grants want to be non-profit. Oh no, baby, I got a whole lot. I got Comcast Company, I got Verizon, I got Chase Bank. No, I got a whole lot of places. It's not just for non-profit, sweetie. This is for private. I got Comcast. Comcast grant is only $5,000, but if you win, they're going to help you do a commercial, and they're going to give you coaching. No, I got a whole bunch of places where it's not just for nonprofits. And I got a girl that works on my team that looks for grants just for people opening home health care agencies, because you guys are part of the community. So as part of being the community, you go under the community-based grants also. So you guys have a lot more opportunity than you realize you have. Just nobody hasn't told you, but I'm going to tell you. I'm going to tell you the information that you need. Okay. Anybody else, girl, we got to get connected. Oh, absolutely. Absolutely. We got to get connected anytime. All you got to do is grab that link, make that appointment. And once you've had your appointment, you are in. And you always have availability to me. You always have availability to me. I've had a couple people join my coaching platform where they work with me for 6 months consistently. So it's a lot of great opportunities. Like I said, I've been working since 2015. If you go to YouTube and go to BP Funding Tree, you'll see there's a couple of my clients on there, and they tell you how I do business and how their business grew. And they'll tell you how much money I got for them in funding, how much I got for them in credit cards. They'll show you everything. I wish it was a way I could play it and you guys can see and hear it. And we could do that tomorrow so you can hear. I'm going to see if it's a way that I can do it. Maybe I can have it playing on my computer. And let me see something. And let me see something.
Word documents. That's it. I format them, upload them to Amazon, and collect royalties.
Hold on. Let me see. Y'all tell me if y'all can. Here we go. All right. Y'all tell me if y'all can see this clearly. Let me go.
My good buddy, Mr. Harris,
This is one of my
Someone
clients.
that you have a relationship with coming on board to the program. So basically, what I would like to do this evening is just speak to you, really just find out how the business credit program has been going for you. And, everyone that's going to, be watching, they're anxious to find out what your experience has been like. Because business credit, there's a lot of companies that offer business credit. Some business credit. So let me ask you a question. Just tell me a little bit about yourself.
Wait a minute, let me go back.
Has been like, because business credit, there's a lot of companies that offer business credit and establish it. And one thing, I'm sure you're fortunate that we have actually been able to produce for you. Some business credit. So let me ask you a question. Just tell me a little bit about yourself and what you do.
Well, I had that one since 2015. Okay. And when I found out about business credit, I was able to get a little for my food truck.
Hold on.
A couple little gas cards and staples.
I'm trying to show you all.
So vendor cards and a couple gas cards when you first started out, and that's really good because a lot of
us, people could tell you what they can do.
We've gotten you a $20,000 Visa card. You also have a $50,000 account, and you just got those were business credit cards, correct?
Yeah, business credit cards.
Mm-hmm. Okay, and you just got $27,000 in funding cash.
Yes.
We were able to get you, and you have a business vehicle. I think that tapped out about $59,000.
Yeah.
So you're about. Say it again.
Drove it off the lot.
Guess what? There's nothing like it, right? Feel comfortable being able to go sit in that seat and know that you would be able, having the confidence to know when I go in here sit down with this dealership, I know I'm going to be able to get whatever it is that I want off the lots.
Yeah, basically. I was like, I want that one right there. And
what did you end up getting?
I got a tricked out Mustang, yeah. 5.
Okay.
Yeah, one of my dream cars.
So that's one of my clients. I got him. I don't know if y'all could hear it. Let me know if y'all could hear it or not. How much was his revenue to get that? Oh, no. He didn't get that on revenue. We built his business credit for him. Okay. All of this we got him on his EIN number, not his social security number. We got it on his EIN number. We got him a $20,000 credit card, a $15,000 credit card, a $30,000 credit card, a $27,000 term loan. We got him approved for a $59,000 sports car, all on his EIN, and that was his first round of funding. He ended up getting $250,000 from us in business funding that we built off of his business credits. Okay, and if anything happens to the business, all that debt goes with the business. Okay, so we teach people not to use your social security. No, they did not ask what his monthly income is. It's because we built his business credit organically. We started from the bottom. We had to build it up. We started with vendor cards. From vendor cards, we went to small credit cards. He kept paying everything on time, and then from there we went to more credit cards. Then from there we was able to go to the community banks. It's a strategy that you have to do. He never had to do a PG. He never did a PG. They didn't ask his business revenue. No, not with his credit cards. No, with your credit card, you state what your income is, and you can state your projected income. Once we get your paydex score up to an 85, there are no answering questions. It's different from, see, if you were going in under your social security number, they're going to want to see your business revenue. But if you're going in and you already have established business credit, you're not, it's totally different. It's two different worlds. It's two different worlds. I can show you guys multiple clients. That's just one client. Let me see.
My clients in person.
Oh, I love when I see my mentor.
Okay, so Louis, thanks for coming to speak with me this evening. And the reason why I wanted to speak with you and I wanted my audience to hear what you have to say is because you decided to join the program. And
Yes.
The program on, establishing business credit and also getting business funding. So before we go there, let me just ask you a question. Tell me a little bit about yourself, a little bit about your business, and what you do.
Well, see, this gentleman here, he had a
I've been a
business.
landlord for the last 20 years. I started when I was 21 years old.
He was a real estate investor. He didn't have an LLC. He didn't have everything. We went in and we fixed him up completely. And he got into our business credit program yesterday and worked with my team. And they built his business credit up. And then the way we had it set up, because we actually worked with him with real estate, he started making a passive income of $10,000 a month working with us on something completely different. I've worked with people and businesses of all different industries, not just the home healthcare industry, all different industries. I've been working with people. So that's what I do now. So that's when you do that one-on-one strategy and I find out exactly what your business knows. We're going over business credit, business funding, what you need. You know what I mean? Because my goal is not to have you spend any of your money, but to have your business credit business. Yep, BP Funding Tree. And I have a website. I've been doing that since 2015. If you Google me, I'll probably still come up on Google. BP Funding Tree will still come up on Google. I was really the big BP Funding Tree was really big at one point in time, but I had got sick, so I slowed down. So before you could just type in my name and I would just come up all over the place. But you see, it's me. So I'm not just helping you start a home healthcare agency. I'm helping you set up a true company. I'm not just going to help you get a couple clients and leave you. Before I leave you, I'm going to make sure that you are set up from A to Z. Okay, that it is a Fortune 500 company running when I leave. That's what the goal is. Yeah, but you guys can go on there and you can listen to the rest of the videos. There's about 3 or 4 of those videos on there. I really need to upload some more for my different clients talking. One of the gentlemen that got the sports car, he is a sergeant in Florida. He works in one of the prisons. I've done a lot of business in Florida too. But guys, any questions that you have? What is the fee for the business credit building? For the business credit building, it's $3,500. Now you have the option to build your own business credits because I created an ebook that walks you from A to Z, from getting your EI, your LI, tell you the vendors, tell you the companies that you can go to get the credit cards. It tells you everything, and you can get that for $29. And you can build it yourself. I set that up that way because I noticed that people they wouldn't have a problem paying the $3,500, but sometimes people would get it in they didn't take care of it. And I figured if people start building their own business credit, you understand what I'm saying, that they will take care of it. So if you're interested in that business credit ebook, just send me a DM and I'll send it over to you. Let me actually follow you back next. And let me write your name down. Would you like me to send you the ebook over there? Mr. Nix, Uleter. Okay, Nix. All right, when I get off, I'll send. Anybody else want me to send you the business credit building book? If you do, just let me know. But that's what the goal is, to make sure that you are set up completely. And okay. I'm gonna send it over to you also. And you wanted the strategy call link also, so I'll send that over to you also. And building, which one do you want? You want the business credit building, or you want the business credit building and the strategy? Building wealth. Building wealth. Building wealth digitally. Okay, Provens, which one do you want? You want the strategy call and you want the business credit building? Let me make sure I got everyone's information. All right, I think I got everyone's information. Okay, I think I got everything. So 1, 2, 3, 4. All right, so I'll send you guys. You want both builders? Okay, I'll send that over to you guys in a couple minutes. Like I said, I got a couple slots left open for next week, so you guys can jump on it. Can I go to my bank, get a card? Huh? What are you saying, beloveds? Can I go to my bank, get a card? I don't understand what you're saying. Rewrite your question, beloveds. Are you saying, can you go to your bank to get a car? Can I go to my bank and build it getting a car? Oh, can you? Oh, okay. What bank do you deal with? Yeah, that's one of the places that we can apply for. But see, what you have to do if you've never had business credit is you have to start with your vendor accounts. And I'll go over all of that with you when we get on the call. You got to make sure you got your EIN number, you got your LLC, you got your business, you got your business bank account, you got your business address. Then we got to get you in 411. We got to get you in Google. It's certain things that we have to do. But I'll go over the whole strategy with you. And then you'll also have the book yourself so you can read everything that yourself. I mean, I would love to take everybody's $3,500. But I will help walk you through everything. I want to see people do it yourself program, instead of it used to be a done for you program where we did 90% of the work and only people had to do 10% of the work. But now I switched it. You guys do 85% of the work and we do 15% of the work. And that's going to ensure that you're going to value it and you're not going to let it go. Because sometimes when people get all that money, they don't know how to handle it. And you got to make sure you have a business plan. You got to make sure everything is in place. Okay, well, if no one has any other questions, I can go ahead and I can let everyone go. Does anyone have any questions? Because we've been on here for an hour. And what I'm going to do is, thank you. I'm going to try to figure out how I can, you know what I could have did? I could have did this. How do I do it? I could have just did that. That's what I could have did. Now Now I know for the next time. All I had to do was flip the camera around and just play the video for you guys to see. But I know for the next time. I didn't know how to do it. I'm new to this. All right, guys. I'm going to send you guys over all your links, and I'm going to send you over the books. I tell you to start reading the book right away. So when we get on the call, you'll be familiar what we're talking about. Also, if you're going to be doing a strategy call with me, write all your questions down prior. Okay, so you can have all of your questions, and you can DM me your questions ahead of time, because I want us to be prepared, because I want this to be a very valuable meeting for you. Okay, so whatever information you want to discuss, write it down, and then once you make your appointment, my assistant is going to send you an email, and you can send over a list of everything that you want to discuss. Okay, guys? All right, guys, I'm so glad I came on this evening. I'm about to send you your links, and go ahead and do your links because I think I got about 3 or 4 slots left for next week. Okay, everyone have a good night, and everyone tap that screen real fast before we leave. Tap that screen, tap that screen, tap that screen, tap that screen, and let's get them hearts going. Okay, guys, you have a good one, and thank you very much. And I'm going to do a second live for you guys, so I'm going to be doing a 9 p.m. live too, okay? All right. Love you guys. Good night.